Hi, my name is Morgan Miller, and I will be doing my final speech as a persuasive speech about whether our country should have free health care. I believe that our country should allow free health care for some people, but not everyone. And when I say that, I mean for children under the age of 18 should have free health care, because who's to say that their parents are bringing in enough money in to the household to pay for their children to go to the doctor, or for their antibiotics or stuff or their medicine or anything when they need it. Because children getting sick, it happens. Like, there's no preventing it. Who's to say a child doesn't have asthma and needs their inhaler? Well, if your parents can't afford it, then you have to go without. I also believe that if you have a disease that requires you to go to the doctor multiple times a month, when I say multiple times, I mean 4 to 5, then you should get free health care, because you have to stay alive or to stay healthy. It's not your fault that you have this disease. I believe that people who go to the doctor like once a year to get their yearly exam or their physical or something like that, that they should not be offered free health care. I understand that that's not fair, that people would consider that not fair, but I mean, there needs to be some sort of income coming to the doctors and the nurses and the receptionists of the doctor's offices and the hospitals. So if you go to the doctor like once, twice a year, then yeah. I believe emergencies, so say a broken arm or a broken leg or a heart attack or something like that, when it requires you to go to the emergency room, that you should not be required to have to pay a copay or or have I don't know how to say it. I feel like you should have free health care for those purposes, because you can't help those things. When they happen, they happen. It's kind of like I was talking about before. A child gets sick, a child breaks their arm. But like I said, kids under 18 should have free health care. But when I say emergencies, I mean emergencies for all ages, because you can't help when you fall down the stairs and break your arm. And then you're going to have these outrageous doctor bills, and you have really good credit at the beginning of this, and say you have a heart attack and spend 2 weeks in the hospital. Well, then if you don't have enough money, then you're going to be you're not going to be able to pay these doctor bills right off the hand when they want their money, and your credit's going to start out high where it's at, and then it's going to slowly drop because you're not being able to pay your medical bills on time, which I'm not saying there's anything wrong with that. People have them. Patients with cancer, I believe, should have no copay, no medical charge whatsoever, because they're going through enough as it is at home and with chemo or whatever treatment they're doing. So I don't believe they should have a medical bill, because they didn't ask for cancer. And I do understand people say that drinking can cause liver cancer and smoking can cause lung cancer, and I understand those can be causes of it. But for example, my grandma, she's been smoking since she was a freshman in high school. She's had ovarian cancer and pancreatic cancer. She doesn't drink. She drank a little bit when she was younger, but she never really was a heavy drinker. And she's never had a touch of lung cancer. So, therefore, it's not her fault that she got the cancer. People who are drug addicts and continuously come back to the doctor's office because they get free health care, that's not fair, so they should have to pay. I also believe that people who have a lower income shouldn't have to pay, like, once they hit the age of 18 or they have a family and like they live with their family and everything. People who have a lower income should not have to pay because are obviously not going to have the money to do it. And people who have a higher income, like I said, with the family and everything, then yes, they should have to pay the for healthcare because they have the money, and like I said, that the hospitals, doctors' offices, different places like that do need their income. So overall, my question of should our country have free healthcare? I do not have a straightforward yes or no answer to it. My answer is going to be that yes and no, that some people should, some people shouldn't, and I understand people say that's not fair, but if you stop and think about it for a second, it is completely fair. All right, thank you.